Hi there, I'm Dr. Morse of the Osteopathic Center. So people always ask, well, what makes one doctor better than another? What makes this one, why should I come to you? So there are 5 different factors of outcomes that particularly play a role in orthopedics and in regenerative medicine. So the first one is essentially the degree of injury. So the stronger the injury, the larger the injury, the more different treatment options you're going to have to be really aggressive. Whereas some of the lighter stuff, you can get away with the less aggressive treatment options because the injury's not as bad. Makes sense. Okay, now there's a couple things that we can control. One is delivery. Delivery is very important. What do I mean by this? So do you want to put the medicine into the IV? Do you want to put the medicine orally? Do you want to put the medicine into the actual injury? Whether if it's a knee injury, into the meniscus, or if it's just generalized into the joint. Do you want to put the medicine directly into the tendon, say the Achilles tendon, or do you want to bathe it all around it and not into the actual tendon at all? That's another option. Then you have practitioner skill set. Not all physicians are trained equally. Not all practitioners are trained the same way. We all have different experiences over the years that essentially help us to grow our craft. So a combination between diagnostics, techniques, communication, and then acquiring the appropriate amount of knowledge, whether it's in general or specifically for this patient, allows us to be very, very effective in what we do. The last two, one we can control, the other one we can't. The one that we can control is what are we putting into that injury. If we're talking about injections, you have what we call prolotherapy, which is kind of the effective but the least amount. You could consider something like ozone, which is high level oxygen, has an additional oxygen molecule that is very commonly used in South America and in Europe. That's a little bit more potent than that. Then you have PRP, which is 3 times as strong on average compared to prolotherapy. Then you have bone marrow aspirate, which is stronger in certain types of cells, much stronger, and that has the potential to fix even larger injuries. Then you have a couple others. You can do lipo, which is essentially taking stem cells from the fat in your body and extracting them, very similar to bone marrow, just a little bit of different type of growth factors in different cells. That's possible. And then you have a couple that we don't come from our body, but come from someone else, whether it's amniotic tissue or placental tissue. The last part is essentially the ability to heal ourselves. So that's the one we can't control. That's essentially genetics. Whether or not your body has the ability to heal this and how well you heal versus somebody else. If you're 20 versus say 50, you're going to heal a lot faster at 20 than you are at 50, unfortunately. So that also plays a role, and that's really one of the only things we can't control. But these are some different things that you can kind of look at and say, what are the different things that impact the outcome of my treatment? So thank you for watching. Take care.